Namaskar. Welcome to my YouTube channel. Today we are going to discuss about Wbhrb Staff Nurse Grade 2 2025 CVT based question answer Part 26. Let's start. The first question. An 18-month-old child was brought to the Wbhrb clinic for booster dose of DPT vaccine. Which among the following muscles is preferred by the nurse to administer vaccine? Option A, dorsogluteal. Option B, ventrogluteal. Option C, deltoid. Option D, vastus lateralis. The correct option is option D, vastus lateralis. An opening of surgical wound edge is called option A, wound evisceration. Option B, wound rupture. Option C, wound approximation. Option D, wound dehiscence. The correct option is option D, wound dehiscence. Amniocentesis is the withdrawal of amniotic fluid in option A, menopause. Option B, lactation. Option C, gestation. Option D, parturition. The correct option is option C, gestation. A biochemical marker of preeclampsia is option A, raised hematocrit level. Option B, raised electrolyte level. Option C, raised HB level. Option D, raised uric acid level. The correct option is option D, raised uric acid level. During the active phase of labor, the cervical dilation per hour in primigravidus is approximately option A, 1.2 cm. Option B, 1.9 cm. Option C, 2.3 cm. Option D, 2.5 cm. The correct option is option A, 1.2 cm. Which vaccine is contaminated in child with history of convulsions? Option A, DPT. Option B, measles. Option C, typhoid. Option D, BCG. The correct option is option A, DPT. Cramer's rules is used for option A, jaundice. Option B, burns. Option C, necrotizing enterocolitis. Option D, asphyxia. The correct option is option A, jaundice. Sunset sign is seen in the following condition. Option A, pyloric stenosis. Option D, hydrocephalus. Option C, tetralogy of Fallot. Option D, seizures. The correct option is option B, hydrocephalus. Among the following, all of the components of Wbhrb except option A, female feticide. Option B, female education. Option C, immunization. Option D, food supplements. The correct option is option A, female feticide. Mission Indradhanush program is related to option A, breastfeeding. Option B, family spacing. Option C, immunization. Option D, nutritional supplementation. The correct option is option C, immunization. According to Gomez classification, 2-degree protein energy malnutrition referred to weight for age percentage of option A, less than 60%. Option B, 76 to 85%. Option C, 60 to 75%. Option D, 86 to 90%. The correct option is option C, 60 to 75%. Which of the following helps in prevention of neutral tube defect in fetus? Option A, vitamin A. Option B, vitamin C. Option C, iron. Option D, folic acid, vitamin B9. The correct option is option D, folic acid, vitamin B9. Meningismus refers to option A, meningeal irritation sign without meningitis. Option B, meningitis without meningeal irritation sign. Option C, headache leading to meningitis. Option D, it occurs commonly in adults. The correct option is option A, meningeal irritation sign without meningitis. Commonly used shunt in hydrocephalus management. Option A, ventriculoatrial, option B ventriculoperitoneal, option C ventriculopericardial, option D ventriculopleural. The correct option is option B ventriculoperitoneal. Most priority nursing intervention while caring for a child who is suffering from tonic-clonic seizure. Option A, start oxygen by mask. Option B, make children sit and provide water. Option C, protect child from self-injury. Option D, apply restraints. The correct option is option C, protect child from self-injury. Nelson syndrome is seen after option A, adrenalectomy, option B, hypopituitarism, option C, hyperpituitarism, option D, deficiency of growth hormone. The correct option is option A, adrenalectomy. Which of the tractions is used to treat fractures of the humerus? Option A, Brand's traction, option B, overhead suspension traction, option C, Thomas Splint traction, option D, 90 to 90 traction. The correct option is option B, overhead suspension traction. Consuming fewer than 130 gram of carbohydrate per day may lead to option A, hypoglycemia, option B, kwashiorkor, option C, marasmus, option D, ketosis. The correct option is option D, ketosis. The triangular QRS STT pattern suggests option A, STEMI, option B, Taucidus, option B, Brugada, option D, none of the above. The correct option is option A, STEMI. Deep S wave in V6 indicates option A, RBBB, option B, WBW type B, option C, RVH, option D, hypercalcemia. The correct option is option C, RVH. Match list 1 with list 2 and select the correct answer using the code given below. A, frontal suture, B, coronal suture, C, lumbar suture, D, sagittal suture. 1. Between frontal and parietal bone, option B, between two parietal bone, option C, between two frontal bones, option D, between the parietal and upper margin of the occipital bone. The correct option is option B, frontal bone between two frontal bones, coronal suture between frontal and parietal bone, lumbar suture between the parietal and upper margin of the occipital bone, sagittal suture between two parietal bone. Shock resulting from severe allergic reaction is option A, septic shock, option B, anaphylactic shock, option C, neurological shock, option D, traumatic shock. The correct option is option B, anaphylactic shock. Which of the following is a major feature of the innate immune system? Option A, slow response time, option B, general and non-specific defense mechanisms, option C, specificity for each pathogen, option D, the ability to remember past infections. The correct option is option B, general and non-specific defense mechanisms. A patient with increased ICP shows Cushing's trait. What should the nurse expect? Option A, tachycardia, option B, hypotension, option C, bradycardia, option D, slow breathing. The correct option is option C, bradycardia. A patient on heparin presents with sudden abdominal pain and drop in BP. What is suspected? Option A, DVT, option B, hemorrhage, option C, pulmonary edema, option D, thrombocytosis. The correct option is option B, hemorrhage. The Bishop's code is used to access option A, placental location, option B, cervical readiness for labor, option C, fetal well-being, option D, gestational age. The correct option is option B, cervical readiness for labor. Which pelvic type is most favorable for vaginal delivery? Option A, android, option B, anthropoid, option C, platyploid, option D, gynecoid. The correct option is option D, gynecoid. Which fetal presentation is considered abnormal? Option A, vertex, option B, breech, option C, occiput anterior, option D, occiput posterior. The correct option is option B, breech. Iron deficiency anemia in children is most common at option A, birth, option B, 6 months to 2 years, option C, 5 to 10 years, option D, adolescence. The correct option is option B, 6 months to 2 years. Pathophysiology of birth asphyxia is related with following condition except dash. Option A, congenital hydrocele, option B, arterial oxygen tension, option C, accumulation of carbon dioxide, option D, fall in blood pH. The correct option is option A, congenital hydrocele. Which hormone is essential for production of milk in mother's breast? Option A, FSH, option B, prolactin, option C, ADH, option D, oxytocin. The correct option is option B, prolactin. Which demographic term refers to the movement of people across regions? Option A, immigration, option B, urbanization, option C, population composition, option D, migration. The correct option is option D, migration. All of these are plasma protein found in the blood except for which one? Option A, albumin, option B, globulin, option C, myosin, option D, fibrinogen. The correct option is option C, myosin. Loss of which of the following leads to decreases muscle coordination? Option A, hypothalamus, option B, cerebrum, option C, midbrain, option D, cerebellum. The correct option is option D, cerebellum. A patient with tuberculosis should be placed under which type of isolation? Option A, contact isolation, option B, droplet isolation, option C, airborne isolation, option D, protective isolation. The correct option is option C, airborne isolation. Emergency contraceptive pills should be taken within option A, 24 hours, option B, 48 hours, option C, 72 hours, option D, 5 days. The correct option is option C, 72 hours. The antidote for organophosphorus poisoning is option A, atropine, option B, adrenaline, option C, naloxone, option D, diazepam. The correct option is option A, atropine. The most common hospital-acquired infection is option A, UTI, option B, pneumonia, option C, sepsis, option D, wound infection. The correct option is option A, UTI. The cold chain at subcenter level is maintained by option A, ASHA, ASHA, option B, ANM, option C, PHCMO, option D, CHO. The correct option is option B, ANM. When a vaccine loses potency due to freezing, it is called option A, denaturation, option B, contamination, option C, evaporation, option D, spoilage. The correct option is option A, denaturation. Hodgkin's disease is a malignancy of option A, heart, option B, lymph nodes, option C, kidney, option D, lung. The correct option is option B, lymph nodes. Herd immunity does not protect individual in option A, diphtheria, option B, poliomyelitis, option C, smallpox, option D, tetanus. The correct option is option D, tetanus. Immunoglobulin found in the mother's milk is option A, IgD, option B, IgA, option C, IgE, option D, IgG. The correct option is option B, IgA. While recording intake output, nurse has to consider insensible water loss from human body and the normal is option A, 200 ml, option B, 400 ml, option C, 800 ml, option D, 1000 ml. The correct option is option C, 800 ml. Bleeding time is prolonged in all the following except option A, viper bite, option B, idiopathic thrombocytopenia, option C, hemophilia A, option D, von Willebrand disease. The correct option is option C, hemophilia A. Which one of the following indicates a nurse has to consider as an indicator of good nutrition? Option A, albumin level 2.5 gram per dl. Option B, pre-albumin level 18 mg per dl. Option C, transferrin level 244 mg per dl. Option D, total lymphocyte 1900 per microliter. The correct option is option B, pre-albumin level 18 mg per dl. Before endotracheal intubation, some facts about trachea a nurse has to understand, and all the following are true regarding trachea except option A, it's about 13 cm long. Option B, it bifurcates into two major bronchi. Option C, it starts at the level of 7 cervical vertebra. Option D, it ends at the level of sternum angle of Lewis. The correct option is option C, it starts at the level of 7 cervical vertebra. When accessing a patient with appendicitis, how a nurse must initiate to get information? Option A, tell me how you are feeling. Option B, tell me where is the pain. Option C, tell me relief of pain with what. Option D, tell me whether cough aggravates pain. The correct option is option B, tell me where is the pain. Which of the following is not the element of the informed consent? Option A, purpose of study. Option B, offer answer only for selective questions. Option C, subject section process. Option D, alternative procedure if any are disclosed. The correct option is option B, offer answer only for selective questions. Which of the following graph is used for recording of maternal and fetal condition during labor? Option A, labor record. Option B, partogram. Option C, vital sign graph. Option D, progress graph. The correct option is option B, partograph. Thank you for watching. Please like and subscribe.